How we live our lives has a direct effect on our health, how much physical activity we have in our daily routine, whether we use tobacco products, and what we eat. All of these lifestyles can play a role in our personal health and quality of life.
Hi, I'm Sidney Evans. If you look across the country at people, there are often differences in how people live according to where they live. And that's especially true in the case of diet.
Regional specialties like Philly cheesesteaks, Chicago-style stuffed pizza, hot dogs, and fried chicken are making significant contributions to Americans' increasing waistline and stroke and heart disease risk. With foods that are often high in fat and calories, America's diet can contribute to health problems such as high blood pressure and obesity. And these conditions can lead to stroke, a leading cause of death in every region of the country.
And the South in particular is referred to as the stroke belt because of the high rates of stroke compared to other parts of the country.
I was up and talking to my daughter-in-law on the telephone, and I heard some noises in the right side of my head, and they sounded like the noises of car motors running or hurricane winds. However, then the noises ended and it became so quiet in my head, and I thought, okay, now this is just too strange. So then I prepared to drive myself to the doctor. I was going in to take a shower, and I think in the shower perhaps my right hand stopped working, and then I realized that I had an emergency. So I headed back toward my kitchen. I was going to try to call 911, and I collapsed before I could get to the kitchen. However, I did manage to maneuver myself into the kitchen and was able to reach the 911 operator. She sent the paramedics to pick me up, and she stayed on the phone with me until they arrived.
If a part of the brain on the left side were denied blood for a while, a person might not be able to speak well or understand speech. They might have a problem moving the opposite side of their body, namely the right side, particularly the face and arm. They may have a disturbance in walking. They might feel dizzy. They might have some disturbance in their vision where they can't see clearly or things might be double. But the hallmark of stroke is this sudden, rapid onset of some type of symptom, much like I described.
The symptoms of stroke are sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, sudden confusion or trouble speaking or understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, and sudden severe headache with no known cause.
One of the most important risk factors for stroke and hypertension is the genetic component. People are oftentimes members of families where first-degree relatives, such as parents or siblings, have high blood pressure or stroke histories, heart attack histories as well. And when you have a family history of this condition, you're much more likely to suffer from it yourself. Of course, if you're overweight, that's a big risk factor. If you smoke or if you drink excessively, then these are also risk factors for stroke and hypertension. Those are the biggest risk factors, but some of those, as you know, can be controlled by behavioral changes, some cannot.
The good news, stroke can be prevented.
We've talked about prevention and what we can do to prevent. One of the things I really want to emphasize is that if you have the following risk: high blood pressure, high cholesterol, obesity, and if you smoke, you need to do something about getting into a healthier lifestyle so that you can reduce these risk factors.
And those healthy lifestyles can help in reaching or maintaining a healthy blood pressure and cholesterol level. The goal should be to have a blood pressure of 120/80 or less, a total cholesterol of 200 or less, an LDL or bad cholesterol of less than 100, and an HDL or good cholesterol of 50 or higher for women and 40 or higher for men.
We're fortunate that there have been incredible advances in medicine that have greatly increased stroke survival rates and improved chances of recovery and rehabilitation.
And I can't stress enough how important it is for anyone who recognizes that they've had a stroke or recognizes a stroke in someone else to act quickly, to come to the emergency room, because we have only 3 hours to give that drug from the well-defined time of onset of someone's stroke. After that period of time, the medicine becomes less effective and also potentially more risky in terms of producing unwanted bleeding. But within that 3-hour period of time, there's a relatively low complication of bleeding and a reasonably high chance that that person, after 1 to 3 months, will have little to no disability from their stroke.
For patients who present beyond the 3-hour window, certain patients may be eligible for more aggressive interventional therapy, and by this I mean intraarterial delivery of therapies that can dissolve the blood clot or remove the blood clot. An angiogram is done where a catheter is placed in the groin and an artery in the groin, and the catheter is thread up in the large artery inside the body to the base of the neck, and then the catheter is then placed into the arteries that supply the brain. Dye is injected, pictures are taken to see where the blockage is, and if the blockage is in a suitable location, then the catheter can be run up further right into the clot, and clot-busting drugs can be given, or a device can be inserted through a catheter, and then the catheter device then snags the clot and then pulls it out, or disrupts the clot so that flow becomes reestablished.
Patients that might come into the hospital in frank coma, completely unconscious because a major blood vessel in the brain has completely been blocked. We know that if that catheter is placed right up to that clot, and if the clot-busting drug is instilled right against that clot, it can be completely dissolved, and the patient can wake up much like a Lazarus type effect. And that can be one of the most dramatic and most rewarding results.
Many communities have a number of resources that can help improve health and reduce the chances of heart disease and stroke. These would include classes and resources to help smokers to kick their cigarette habit, exercise programs and facilities, venues for buying fresh fruits and vegetables, programs like the Fit City Challenge that help improve diet and physical activity levels, and nationally certified stroke treatment facilities. To help you understand your risk factors for stroke, here are some things you should discuss with your health care provider. What is my blood pressure? An optimal blood pressure is around 120/80. What is my total cholesterol level? A total cholesterol that is 200 or below will decrease your risk of stroke. What are my LDL and HDL cholesterol levels? Your LDL, or bad cholesterol, should be less than 100. Your HDL, or good cholesterol, should be above 40. If any of your tests indicate a problem, ask your healthcare provider how you can lower your risk for stroke. Also, be sure to get regular checkups. Your healthcare provider will schedule your tests based upon your health risks. Keep your appointments and know your numbers. They can help you better manage your health and reduce your risk for stroke. Finally, if you or anyone around you exhibits the symptoms of stroke, seek help immediately by calling 911.
The key? Education. Educating our citizens on how to adopt a lifestyle that is heart-friendly, and teaching folks how to recognize stroke and get the appropriate help. If people have the tools, then they can certainly make a difference in their lives and their community. I'm Sidney Evans. Thanks so much for joining me, and here's to a healthy lifestyle.